So I'm going to focus on kind of three aspects of our policy. I'm going to look at the momentum factors. What were the key things that kind of prompted us getting a policy off the ground in the first place. I'll talk about some of the key success factors, and I'll mention kind of key lessons learned. So starting with momentum factors, next slide, please, Mike. I'm not going to kind of bore anyone with too much data, but I think it's really important to emphasize the importance of evidence and data in providing a rationale for policy and informing policy. And very often we get kind of preoccupied with differences, in relation to health outcomes between males and females, whereas this slide tells a much more kind of interesting story. It's looking at premature mortality, in other words, dying between the ages of 30 and 69 in the European Union. And on the left of the screen are the more well-off countries, in Western Europe predominantly. On the right-hand side of the screen is mostly Eastern European countries, the less well-off countries. So you can see the slope of the line for women is quite modest. So yes, there is higher chance of dying prematurely in less well-off countries than in more well-off countries for women. But the slope of the line for men is much more pronounced. So what this tells us is that it's really important to not just look at men's health in a broad sense, but to examine what populations of men are most at risk of adverse health outcomes. And then at a policy level, then to consider what is it about the context of these men's lives, what is it about the environments in which they live and work and so on, that we talked about earlier, that we need to address in order to bring about improvements in health outcomes. And this is also important from an economic point of view, because obviously premature mortality is a huge cost in terms of loss of productivity, loss to family, communities and workplaces and so on as well. Next slide. I mentioned the importance earlier of women in terms of advocacy for men's health, but getting a policy off the ground was hugely influenced by both kind of top-down and bottom-up efforts on the part of many in Ireland to get a focus on men's health. And what was crucial was that prior to the development of the policy in the early 2000s, men were named as a specific population group in our national health strategy. So the need for a policy was named at a national health strategy, which is really important. So I would just acknowledge the role played by different kind of awareness groups and advocacy groups, men's organisations like the Men's Health Forum in Ireland and the Men's Development Network, for example, but also then key figures in public health and health promotion who kept championing the case for an increased focus on men's health. Next slide. John has already talked a good bit about masculinity, so I won't dwell on this too long. But the traditional script, masculinity script, has suggested that men need to be strong and tough and resilient and demonstrate their masculinity to others, and this has often been at the expense of their health. But as we discussed earlier, masculinity takes many shapes and forms. It's not fixed or set in stone. Men can change and do change over time. So whilst acknowledging, if you like, the limitations of a traditional masculinity script, it is really important to look at ways in which we can reshape masculinities to have a more positive influence on health. Next slide. And just the links between masculinities and health have been kind of highlighted in the literature. And traditionally men haven't paid as much attention to their health as women, as we've discussed. But we are looking now at ways of trying to develop health promotion programs and public health programs that target men and that build on kind of positive aspects of masculinity more. Next slide. Okay, so what have the key success factors been in terms of our policy to date? So the first policy was launched the first action plan part of it was launched in 2009. There was an independent review carried out after 5 years, 6 years, and we're just coming to the end of our second 5-year action plan phase. So essentially we have about 11 years or 12 years this year of men's health policy implementation to draw upon in terms of assessing success factors. Next slide. The first thing to highlight is what's really stood to us, I think, has been the robust process of policy development and implementation. I mentioned men being named in our National Health Strategy in 2001. That was really important. The Department of Health then commissioned a comprehensive research proposal, which was designed to inform the development of a national men's health policy. The actual policy itself was underpinned by an extensive consultation process that was very comprehensive. Following publication of the policy in 2009, there was various kind of governance issues that were put in place. A national men's health policy implementation group that was chaired by the Department of Health and by the Health Service Executive. An independent review conducted by Peter Baker in 2015, and the publication of a kind of more streamlined men's health action plan, Healthy Ireland Men, in 2016. So the first key element to highlight in terms of why the men's health policy has been effective, mostly I think, is that it's been underpinned by strong governance and by a very methodical policy development phase. A key learning from the first phase of policy implementation, as I mentioned in the last slide, was the need for a more kind of streamlined approach to men's health. The original policy contained, I suppose you could call it, a very aspirational range of recommendations and actions, some of which were implemented, but many of which were not. So following Peter Baker's review, the decision was taken to try and focus attention in particular on the priorities in our Healthy Ireland National Health Strategy, and that the revised action plan would be focused on the priority programs within the Healthy Ireland agenda. So essentially, the Healthy Ireland Men became an instrument of national men's health policy implementation. Next slide. We've talked earlier about the importance of kind of evidence-based approaches to men's health. So one really positive outcome from the policy has been an exponential rise in research and evaluation of programs across a range of sectors: suicide prevention, cancer, cardiovascular diseases, and lots of other areas as well. So we have a kind of a rich kind of array of evidence-based evaluations and toolkits and so on that have really informed future and ongoing programs in men's health. Next slide. A key part of the success of the implementation of the policy has been what I would call kind of key capacity building measures. And central to that has been the development of a national men's health training program called Engage. And that's essentially about training service providers, not just in health services, but across kind of social care and other settings as well, to understand and have a better and more effective approach to engaging men in their health. And over the course of the last 10 years, that has evolved and developed. There's a new module on engaging young men, a more recent module on engaging middle-aged men, and we're just in the process of implementing a part of Engage that's focused on training agricultural advisors to engage farmers in their health. So this has been really important in terms of, if you like, spreading the gospel about men's health and equipping service providers with the skills to be more effective in engaging men. Next slide. I'm not going to mention too many programs, just two as an example, and I mentioned Sheds for Life earlier. But I mean, very often you hear the line that, the hard to reach groups of men, that certain groups of men don't engage with their health. And older men in sheds who might expect to hold traditional views of masculinity and so on are one such group. But as I said earlier, this has been a really, really successful program. It's just finishing the evaluation phase, and it's looking to be scaled up next year with funding from Sláintecare Ireland. But there's kind of four pillars there, as I said, as you can see in the bottom of the slide: a health check, physical activity pillar, and healthy eating pillar. And then there's optional extras as well. So this program is shaped and owned by the men in sheds themselves. It builds on the health enhancing properties of sheds, as a safe space where men can congregate and share skills and feel comfortable in each other's company. And so it's that outreach approach to engaging men in settings where they feel comfortable, and engaging men as partners in the decision-making process around program development and implementation. Next slide. We're still talking about success factors, but I'm just talking about a couple of examples of national programs that kind of dispel the myth that men don't engage with their health. So this was a cardiovascular health behavior change program that targeted farmers in mart settings and agri-branch, they're kind of co-op settings where farmers buy produce for their farms. So it comprised a health screening at baseline, different options of interventions which farmers self-selected into, including text messaging, health coaching, and other types of interventions, and then a follow-up health check at 52 weeks. And you can see the project partners that were involved at the bottom there, including Glanbia Ireland, which is a multinational agri-food business. I mean, I could say a lot about this. It's been really effective on so many levels, but the most interesting point that I think is worth saying in this context is that of the 850-something farmers that opted in, at 52 weeks, 88% of them were still involved in the program. So, they stuck with the program. The adherence to the interventions was really high, and the dropout was really low. So again, when the approach is right, that community outreach approach, and respecting farmers as decision makers in their own healthcare, that's when really success and magic kind of happens in terms of program provision. Okay, move on again. So on to the last slide. What are the key lessons learned? The importance of identifying men as a target population group at a national health policy level. So this was really important in getting men named as a specific population group in our national health strategy. And when it came to publishing the policy many years later, at the height of the economic crisis, this was something that proved to be politically really important, because at the time we had a minister that wasn't too keen to publish a policy without much budget to go with it. But because the commitment had been made in our national health strategy, the decision was taken to go ahead and launch it. So again, this is a kind of political issue that's in terms of policy that's really important to note. Next bullet. The consultation process that was involved in developing the policy was important, obviously, in informing policy development, but also was critically important in terms of laying the foundations for the subsequent partnership model that was the cornerstone of policy implementation. So phase 3 of the consultation process engaged with 5 different government departments, obviously the different branches of the health services, and other key stakeholders who were named as being responsible for certain recommendations and actions in the action plan part. And we thought this would take 2 or 3 months, but it took about 18 months because it was so difficult to get sign-off on different things. But it was really instrumental in building relationships, getting commitment, and driving on from that kind of solid platform. So the consultation piece was really important in building those partnerships and getting buy-in and support for the subsequent action plan. Next bullet. The importance of having in place strong governance and accountability measures. So having the national implementation group was really important. Having an external review at the end of the 5 years was important. Having research and evidence informing the different programs as we went along was really important. There was a national plan each year with key indicators of what the outcomes would be, and reflection on that then in the final evaluation process. So that governance issue was really important in terms of remaining accountable to achieving our goals and objectives. Next bullet. The importance of leadership and advocacy in sustaining men's health on a policy agenda. So this has been really important. And there's been politics involved in this as well, with a small p, I guess. So we've used every opportunity to engage ministers for health, senior and junior ministers, to launch different research reports, to be present at different men's health events, such as International Men's Day or National Men's Health Week. So we've worked really hard, and we meaning the Men's Health Forum in Ireland and other men's health advocacy groups, and also then the section within the Health Service Executive that's tasked with implementing this. So that leadership and advocacy has been really important. And I mentioned the role played by Biddy O'Neill, Health Promotion Manager, who was the key leader in getting this off the ground and from day one. Next bullet. The strong partnership working between the statutory, community, voluntary and academic sectors in building a strong evidence base. So a lot of our evaluation and research programs have had an applied focus. So, for example, I mentioned two earlier, the Sheds for Life program that involves about 8 or 10 different service providers, the NGOs, the Irish Men's Sheds Association, and then there's 2 academic institutions who are tasked with conducting the evaluation. So this has been a model that has worked across a number of different programs where academics, advocates, and service providers work in partnership to generate strong research outcomes. And last couple of points. The highly significant role that Engage played in building capacity to support policy and implementation. So the National Engage Men's Health Training Programme has been really important in building alliances and getting allies on board to continue to keep men's health on the policy agenda. So it's been difficult to engage GPs, but we've had some success there, but across all sorts of other functions, and including more intersectoral work with Department of Agriculture now, we're building kind of a support network of like-minded souls who want to keep men's health on the agenda and to develop innovative programs to promote men's health. And the last point, I think, Healthy Ireland Men is now seen as an important instrument to implement the Healthy Ireland agenda. So we've had different kind of kickback at different times saying we don't want the kind of siloing of men's health and women's health. And I think that's a really important point. So men's health policy is not about competing for scarce resources for men. It's about having a gender sensitive or a gender transformative approach to implement policy across a broad range of sectors, including areas we've mentioned like suicide prevention, and including also our national health strategy. So Healthy Ireland Men is an instrument to support policy implementation across a range of sectors. It's not about trying to garner limited resources or take away from women's or children's health. It's never about that. It's about being alert to approaches and methodologies that will be effective in engaging men in their health. Last slide there is just a nice picture of us launching at the launch of the WHO European Men's Health Strategy, and we've kind of fed into that strategy a good bit as well. So thank you for your time.